Santa Clara Valley Medical Center is the safety net hospital of Silicon Valley, of all of Santa Clara County. And what was happening is the hospital was getting overcrowded. And when the hospital gets overcrowded, the ER gets overcrowded. We can't just move these patients out while they're still sick and try to get them out. And as we did a deeper dive, what we recognized is the reason why we were overcrowded is there were a lot of patients that we had that were simply non-acute, sitting in the hospital.
Oftentimes those patients can be in the hospital and not have an acute medical need to be there, but they can't be safely discharged to the streets.
One of the hospitalists over here, one of our mentors, told us that the most dangerous thing you could do for a patient is to discharge them. And with good reason, because in the hospital they're monitored, but once you discharge them, you have no idea what happened. A significant number of them, unfortunately, are homeless. They have very complex medical conditions.
So we had to come up with our own bold solution on how to care for these patients.
We thought, well, what would be the ideal transitions model for these patients? And so a number of them, ideally what they would need is a full multidisciplinary team to help them with medications, to help them with mental health issues.
We just kind of flew by the seat of our pants and adapted and learned and changed as we saw fit. It goes back out to going beyond the walls, breaking down the silos. Talking to individuals that I would have never talked to. It involves case managers, social workers, psychiatrists, psychologists. It involves so many different departments.
They don't have the physical or the social supports that a lot of us take for granted.
Essentially, that was our compass, was what can we do to take care of the patient?
Overall, from a holistic standpoint, it's been an incredible success for us.
Every hospital, private or public, encounters this problem, and that's why we want to develop something that can hopefully be replicated by others. We want to share the secret.
It's incredibly fulfilling, gratifying as a provider to be able to affect someone on such a deep and personal level, and to see the outcomes that we can achieve.